thankful to Bonenkar people who has allowed me to share some of the innovations which we have done for the fixation and the bony injuries in orthopedics. So what I'm going to talk about, where I am not directly attached financially with the company, it's my mentality, my passion to go with the research, and that's why I am associated with these people. So first one is an Ahmedabad Bolt. So what exactly is, there are male and female two components of a bolt. So when we wanted to have a good compression between the two condyles of the tibia, where there is a fracture and they are separated, so we reduce it, and then with a specific tools and specific instruments, and there is a series or steps of the instruments by which we pass this screw of a measured size, one from one side male and other side female. They have got the threads inside. So when they are threaded on each other, there is a very good compression which occurs at the metaphyseal region, at the intra-articular region. And this fixation, this compression is so good that there is hardly any synovial leak, which is the concern for us. So we are very happy with this, all the different instruments which have been made for this particular screw, and the required length of each screw with male and female parts. And here are some of the results where this research has been now for more than 2 years. So recently we had so many cases where have been operated, and after 4 months of the final healing, here you can see that there is a fracture of the proximal part of the tibia, which has been reduced, which has been fixed by a plate. But proximal to the plate, you can see that there are Ahmedabad bolts, which are two bolts which are there, and that gives a very good fixation, and we can avoid second plating in such cases. There is another case where there is a fracture of the lower end of the femur, where again same Ahmedabad bolt has been used, and look at the fantastic result at the end. And here also we get a absolute good trajectory where we want to have a compression, and we can also add couple of other screws where there is a small fragments, but basically it is the Ahmedabad bolt which gives a good compression. One more case where you can see on the left side a fracture, and on right side it is completely healed with Ahmedabad bolt, and there is also a thin plate below. And I'm going to talk about that thin plate, which is we call it a point supporting plate, which is also another innovations we have done with this company. One more case, you can see a very small plate, which is a point supporting plate plus two Ahmedabad bolt, and that gives a fantastic result. And patient can start early mobilization with this because the fixation is so well that there is hardly any chance of loss of reduction or any instability after fixation. And that is the advantage of this new design. Here you can see we have passed one Ahmedabad bolt, another simple screw, but there is a girdle type of another right angle screw. So such type of assembly, such type of fixation is so much helpful because we can go with a minimum implant, although there is a big fracture, but we can avoid plating. Here you can see another case of the lower end of femur, where there was already another fracture in past, for which it was fixed with the interlocking nail, and there was also a fracture of the patella. Altogether, we get a space to pass Ahmedabad bolt, and simple one bolt is going to fix the fracture. And here you can see a big fracture on the left side, and you can just find out that there is such a big fracture. Only single bolt has worked, and you hardly can see the fracture line. So this is the amount of compression we get because of the male and female threads which are that. Now, how do we pass this bolt? We also use a Gujarat guide, which is something like a thick K wire, and this thick K wire has a small sort of a dip at the back of this, through which we are passing the original guide wire. The original guide wire is only 2.3 mm, which might deviate when we want to pass inside the board. So we have a liberty to use 3 mm K-wire, and that K-wire has a small back slot. Here you can see. So that K-wire goes inside, and then you can have a railroad type of a method by which you can look at this. The wire which is now withdrawn, and in that a railroad type of original guide pin is introduced. So this is a Gujarat guide, and this Gujarat guide is conceptually very important because the trajectory has to be precise. If you can put the screw direction in exactly right angle to the fracture plane, then only you are going to get best of the compression. And that is how we got this another innovations. Here you can see one more case, a single screw and a best of the fixation. So there are many cases where we feel like that what we will do, how much incision will be there, how much patient's hospital stay will be there. All these things are cut down, which is minimal invasive, but a very good compression device. We can also add with a plate in couple of cases. There are some cases where there is a very bad fracture, but the intra-articular part can be very well